Ow! 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 Stop! She has a congenital heart defect. More specifically, she has ventricular septal defect.
What is ventricular septal defect?
Well, I'm glad you asked. Ventricular septal defect, otherwise known as VSD, is a congenital heart defect that affects the septum wall within the heart between the right and left ventricles. Approximately 1% of all newborns are born with a congenital heart defect. Of that 1%, 25 to 30% of them have VSD.
Okay, but what does that have to do with me?
Well, it can affect children and a very small number of teens as well.
Wait, I'm a teen?
Well, it can affect you too. Well, I'm not trying to scare you, but here's a little bit more information about VSD.
Let's talk a little bit more about the pathophysiology of VSD. First, let's start with the normal blood flow of the heart. So first we have deoxygenated blood coming from all around the body and flowing into the heart through the superior and inferior vena cava. From there, it flows into the right atrium, past the tricuspid valve, and then the right ventricle, where it will be pumped to the pulmonary artery through the pulmonic valve. And from there, it'll flow to the lungs, where it'll go through a gas exchange and become oxygenated. Once the blood is oxygenated, it'll be pumped back to the heart through the pulmonary veins into the left atrium, through the mitral valve, and then into the left ventricle. From there, the left ventricle will pump the oxygenated blood through the aortic valve and then into the aorta, where the oxygenated blood can be pumped to the rest of the body. So with VSD, the blood is flowing not only to the aorta, but also through the defect to the right ventricle. This means that there is increased blood volume which is being pumped to the lungs. Because of that, it can increase the pulmonary vascular resistance in the heart, which can lead to pulmonary hypertension. If this goes on, it can lead to right ventricular hypertrophy. This is when there's an abnormal enlargement or pathologic increase in the muscle mass of the right ventricle. If this goes on, the right ventricular pressure can slowly become greater than the left ventricular pressure. Eventually, this can lead to a complication known as Eisenmenger syndrome, where the change in pressure can create a right to left shunt rather than the left to right. Some signs and symptoms include shortness of breath, fatigue, thrills, murmurs, and inability to gain weight. Teens with VSD are at greater risk for developing endocarditis, an infection of the inner surface of the heart caused by bacteria in the bloodstream. Teens who have this heart defect should avoid getting body piercings. A piercing will increase the possibility that bacteria can get into the bloodstream, infect the heart, and damage the heart valves. If you're considering a piercing and you have a heart defect, talk to your doctor first.
Now you know some of the ways that VSD can affect you and your loved ones.
Yeah, now I know. Thanks, Rutgers. Thank you.